We have a patient which is 55 years old using mixed and penfill. So these two will be lowering blood glucose, and it can even cause hypoglycemia. And let's see this. Also uses enalapril AC inhibitor. Cold sweat, headache, drowsiness, tremor, and unconcentrated. These are hypoglycemia symptoms. It could be due to skipping food, it could be due to wrong technique, and kind of things like that. Here we have a long acting insulin and also short acting insulin. And as a result, we see increased urination, acetone, smell of breath, tremor, increased thirst. Until here, we can say that this person is having diabetic ketoacidosis. Diabetic ketoacidosis means that your blood is getting acidic, low pH. And we should check ketone levels in blood. It is around like that, more than that, the value of it. And as a result, in the diabetic ketoacidosis, we see acetone smell of breath, which is known as fruity breath. We see the person is vomiting, having a stomach pain, hardly breathing. This is very, very dangerous, like very dangerous. So we should be using correction insulin, and we can use some fluids. Increased thirst is due to dehydration because this person's body will be trying to get rid of the sugar with the urine probably, and then there will be increased urination, and as a result we see increased thirst. So this is diabetic ketoacidosis symptoms. Why does it happen? This person is using two insulins. Why? Because the insulin is not enough here, and this tremor is happening due to dehydration again. So our patient is taking metformin. This is our case, by the way. This is case 3. Metformin, and also takes Amaryl. Amaryl is known as glimepiride, lowers the blood sugar again. Alright, so this person has a diarrhea. Alright, metformin causes GI problems. That's very normal. That's why sometimes even we give metformin XR. This is better. And indigestion, this is also normal with the metformin. Nausea is again normal. Stomach upset is normal. This is usually due to metformin's effects. We can give metformin XR, but of course the effect of Amaryl will be increasing this effect. So we have a patient who is 65, who has diabetes, who drinks alcohol. So what does it mean? It means that they have older age, they have diabetes, and they have alcohol. So their heart is weaker, already weak. Already blood vessels are damaged. And we have thioactic acid. Thioactic acid is used for neuropathy. Neuropathy means numbness and like numbness in your legs, in your feet. Once you have diabetes, you have this numbness. And also we use Avandia. Avandia is thiazolinodiones. I don't know if my pronunciation is right. So this Avandia will make your heart work harder because it will keep the water. That's why it will make your body keep the extra water. That's why your heart needs to work harder, but your heart is already weak, and as a result your heart cannot get enough blood, enough oxygen. This will cause chest pain. So chest pain and back pain causes because of Avandia. It is making the heart work harder, and patient's heart is already weakened. That's why.